Let me tell you about something that's quietly becoming a summer nightmare for coastal communities. Imagine this: you're soaking up the sun on a Louisiana beach, maybe even splashing in the waves, and suddenly your skin starts reacting like it's under attack. That's not just a horror movie plot, it's a real threat from a bacteria that's been making headlines this year. And here's the kicker: this isn't just some random outbreak. It's part of a larger pattern that's getting scarier by the day. Now, I know what you're thinking: wait, flesh-eating bacteria? That sounds like something from a sci-fi movie. But here's the thing: this isn't fiction. Vibrio vulnificus is real, and it's thriving in the Gulf Coast right now. Louisiana officials have confirmed 9 cases this year alone, with 5 deaths. That's not just a number, it's a wake-up call. What's even more unsettling is that this isn't an isolated incident. Over the past decade, the average was 7 cases and 1 death. So we're seeing a troubling uptick, and it's not just Louisiana. Florida's numbers are even more alarming, with 14 cases and 2 deaths this year compared to last year's totals. This isn't a regional problem, it's a growing crisis. Let's break this down. Vibrio vulnificus isn't some alien invader. It's a bacteria that's been around for ages, but it's getting bolder. It loves warm, brackish water, think estuaries, lagoons, and the Gulf of Mexico. And here's where it gets really interesting: the CDC says this particular strain has a fatality rate of up to 20%, which is way higher than other Vibrio types. That's not just scary, it's a medical emergency. But what's even more concerning is who's most at risk. Elderly folks, people with compromised immune systems, and those with liver disease or diabetes are the ones who get hit hardest. And honestly, that's a ticking time bomb for our aging population and the rise of chronic illnesses. Now, I want you to picture this: you're out in the water, maybe with a small cut or scrape you didn't even notice. That's all it takes. Vibrio doesn't need to be ingested, it just needs a tiny opening in your skin. That's why health officials are so insistent about washing wounds after being in coastal waters. But here's the thing: most people don't take that seriously. They think, I just got a little sunburn, it'll be fine. And that's exactly the kind of mindset that leads to disaster. Because once that bacteria gets inside you, it's not just a skin infection, it's a race against time. Symptoms like fever, chills, and darkening skin patches are red flags, but by the time someone realizes what's happening, it might already be too late. And let's not ignore the bigger picture here. Climate change isn't just melting ice caps, it's turning our oceans into breeding grounds for pathogens. A 2023 study found that the northernmost cases of Vibrio infections are creeping up by about 30 miles every year. That means places that used to be safe are now at risk. It's not just about warmer waters, it's about ecosystems shifting in ways we're not fully prepared for. I mean, can you imagine a future where beaches in New England are warning signs for Vibrio? That's not a stretch, it's a possibility we need to confront. So what can we do? Well, here's the good news: prevention is possible. Washing wounds thoroughly, avoiding raw shellfish, and cooking seafood properly are all steps that can save lives. But here's the catch: these aren't just individual actions. They're part of a larger conversation about public health, climate resilience, and how we interact with our environment. If we keep ignoring the signs, we're not just putting ourselves at risk, we're setting the stage for a public health crisis that could spiral out of control. And honestly, that's not a future I want to live in. What do you think? Are we ready to face the reality that our changing climate is rewriting the rules of survival for humans and microbes alike?